Good afternoon, everyone from the Philippines. I am Rizal Giovanni Aportadera of the Philippine Broadcasting Service. And welcome to the Asia Pacific Institute for Broadcasting Development regional webinar on Women Leading the New Future. We are joined by attendees from over 30 countries from all over the globe, from Asia Pacific, Europe, Latin America, USA, and Africa. Among those who are attending are diplomats, UN representatives, government officials, media members of the academe, and IGO and NGOs. Thank you for joining us on this platform and on Facebook live stream. There's a major shift happening in the world. We see progressive movements that gain traction and support, niche ideas that get mainstreamed and thus change perceptions, cultures, and which become the new norm. With the COVID-19 pandemic, when all countries were racing to adapt to the changes, a show of extraordinary strength and leadership, and a vision and brilliance was seen from some leaders. And these leaders are overturning age-old perception and creating tremendous track records. The world is now seeing the era of women leaders. Leaders are strong visionaries, goal-oriented, and very much human. They command respect, admiration, and inspiration from their team. Today, we have 8 women in this webinar, Women Leading the New Future, and I'm excited to hear their success stories. But first, let's call upon Mr. Rajiv Singh, President of AIBD and CFO of Prasar Bharati, to give his opening remarks.
Greetings to all the participants. On behalf of AIBD Secretariat and Prasar Bharati, India's public service broadcaster, I would like to welcome you all to this very important webinar on Women Leading the New Future. I would like to thank and congratulate Ms. Philomena, Director of AIBD, and her staff for organizing this timely and relevant topic on women leadership. We all know that gender equality is one of the major issues in many countries. There are various problems, issues, and challenges that the growth of women's potential and capabilities. Some are deeply rooted in cultures and traditions, and to this day, it has been very difficult to break these stereotypes. In many workplaces around the world, it has been reported that there are some sort of discrimination against women. This deprives women from taking part in decision-making activities in the workplace. No country in the world has reached the last mile on gender inequality. The other issue that we all know is balancing between work and family. That shattered the dreams of many women who wanted to pursue career. There are many promising and potential women leaders who have given up their careers to take care of family matters. Successful women leaders must come forward more often to speak about the opportunities, realities, and the challenges. This will encourage and prepare young women to challenge and break the beliefs and systems which prevent them from reaching their full potential. By this, I mean equal opportunity should be given to all the women. I'm happy to be the part of this event because this is one of such events where women leaders have come together to discuss on how to navigate the future. There are many role models here today, and I urge you all to come out more often and speak about your success story. There are millions of future women leaders out there longing for guidance and support. To be like one of you in the future. It is also an earnest desire to see the world overcome the COVID-19 pandemic soon, which has changed our lives' perspective forever. Thank you once again, and my heartiest welcome to all the speakers and delegates. Thank you.
Thank you very much, Mr. Rajiv Singh. Good friend I got to meet before we all had the lockdown, and I'm happy to see you again online.
Same here.
Next, I would like to call upon the #1 lady for the United Nations in Asia Pacific, Her Excellency Dr. Armida Salcia Alishabana. Dr. Armida had held several admirable portfolios in the region, most notably Minister of National Development Planning in Indonesia. Ms. Armida served as alternate governor of the World Bank and alternate governor of the Asian Development Bank, representing the government of Indonesia. With notable research projects and consultancies from various organizations and universities, her contribution to the world economic arena is hugely commendable. Ladies and gentlemen, may I invite Her Excellency Ms. Armida Salcha Alishabana, Undersecretary General of United Nations and Executive Secretary of Economic and Social Commission Asia and Pacific, to give her keynote address.
Thank you very much, Rizal, for the introduction. Mr. Rajiv Singh, Philomena Ganapragasam, distinguished participants, colleagues, ladies and gentlemen, it is indeed my pleasure to address the AIBD, a seminar on women's leading the new future. Over the past few decades, the Asia-Pacific region has emerged as the most dynamic region in the world. Our countries make up an impressive engine of economic growth driven by investment, technology, innovation, and productivity. Women have contributed greatly in steering this development success, thereby promoting an increasingly inclusive and sustainable economic growth. The COVID-19 pandemic is now complicating this narrative. Last week, the United Nations Secretary General, Antonio Guterres, warned that the devastating social and economic impact on women and girls is reversing limited and fragile progress on gender equality due to COVID-19 pandemic. These emerging pandemic-induced challenges are certainly slowing progress towards achieving the SDGs. For example, women healthcare workers at the forefront of fighting this pandemic have witnessed disproportionate burden both on their health and well-being. Women have also felt the brunt of the economic impact as they constitute the majority of the informal sector workforce or as entrepreneurs running MSMEs, the micro, small, and medium-sized enterprises across the region. Last but not least, many women and girls continue to experience physical or sexual violence, which has further increased during the lockdowns. For example, in Asia Pacific, about 15 to 68%, it's quite a range depending on where you are, of women on average are suffering from gender-based violence. Ladies and gentlemen, the Beijing Platform for Action marks its 25th year anniversary this year, which championed global commitment to gender equality. Last year, 2019, UN-led Asia-Pacific Regional Review indicated that the region, despite remarkable achievements, need to accelerate progress on SDG 5, which is on gender equality and the empowerment of women and girls. Allow me to highlight 3 key challenges as follows. Women continue to bear the burden of unpaid care work at home. On an average day, women spend about 4 times as much time on unpaid care work than their male counterparts, limiting their full economic potential in our societies. Women's labor force participation rates also remain significantly lower than men's in our region. The gap between male and female labor force participation is more than 30%, which restricts access to social protection and other employment benefits. And also the improvement of gender data and statistics remains a key focus. Gaps in gender statistics have been one of the key factors that hinder informed decision-making and better measurement of progress in gender equality and empowerment of women and girls. Colleagues, ladies and gentlemen, at the Asia-Pacific Beijing Plus 25 Declaration, adopted in November 2019 at the Regional Ministerial Conference in Bangkok, member states reaffirmed and renewed their commitment and recognized the importance of women and girls as key agents of change for the Asia-Pacific Sustainable Development Journey. However, the outbreak of COVID-19 over the past 6 months have widened the existing socioeconomic inequalities that women have faced for a long time in our region. As such, women are at greater risk of losing their jobs and incomes. In fact, across the nation's parliaments, share of women in positions of leadership has increased, but yet these numbers are far below the global average. Colleagues, ladies and gentlemen, the United Nations family, including ESCAP, we are strengthening the gender dimensions through institutionalizing efforts for gender-responsive regional program to leave no one behind. In view of this, let me focus on 3 policy issues for your further deliberation and consideration. First, we must improve social protection systems and widen the safety nets. Governments need to advocate for the allocation of sufficient fiscal space, especially targeting women and girls, along with an improved regulatory and policy framework. Secondly, let us emphasize women's entrepreneurship as a catalyst for promoting women's economic empowerment. Increasing women entrepreneurs' access to finance and digital technology through partnership with governments, financial institutions, and the private sector are essential elements in this process. And thirdly, we must work together in improving gender data and statistics along with development partners. Collecting and analyzing high quality, timely, and sex disaggregated data can measure progress on gender equality and the empowerment of women and girls. Yeah, so I think, So this slide shows or illustrates the 3 focus areas that I just mentioned. Yeah, on social protection, on empowerment and leadership, as well as on data and statistics. Next slide, please. Yeah, so colleagues, ladies and gentlemen, on the occasion of the 75th anniversary of the United Nations, let us join forces with governments, the private sector, civil society, and media to usher women's transformative leadership. Inclusive multilateralism and solidarity are essential to create the new future. Thank you very much.
Thank you very much, Excellency Armida. Now it is time for me to hand over to my co-moderator and host of the event. She is a broadcaster with much experience, somebody who broke the glass ceiling herself when she became the first woman director of AIBD. And I was also fortunate to have witnessed that momentous occasion. Allow me to introduce Ms. Filomena Nana Pragasam, Director, Asia Pacific Institute for Broadcasting Development, or AIBD. Philo?
Thank you, Rizal, and good greetings, everybody, because we're joined by women as well as men from over 37 countries across the globe. And we're really happy that this webinar, Women Leading the Future, is attracting not only the women, but also men. So thank you, guys. So what I would like to say is thank you so much to the keynote speaker today, Dr. Armida. I think she has very nicely put the particular emphasis that should be given to women, right? To bridge the gender gap as well. And I like that because it is one of the main things is to address gender inequality by looking at social protection systems, women's entrepreneurship, and also to improve gender data and statistics. And most of all, Dr. I like ASCAP's support, the theme, Build Back Better. And this is especially more so after the pandemic. So thank you for looking into this. And I'm sure that with ASCAP's support and initiatives, we are definitely going to build back better. right? And without much ado now, I would like to look at what's going to happen today. We're joined by very, very prominent women. So I would like to say hello to all of you for taking the time to be here today to empower all of us across the globe. So leaders is a special word, and it refers to a special class of people with the ability, aptitude, and will to guide and motivate others. And so we have women here, the epitome of success. And I would love to introduce this illustrious panel of global women leaders on our webinar, Women Leading the Future. Let's see who we have on our panel. Thank you. Okay, there you go. You just saw the whole list of women out there. And without much ado, I'd like to introduce our very first speaker. And I'm really grateful that she's on board today. A true orator and a politician. A woman who actually wears many hats. She has bold ideas and she reflects the progressive ethos of the multicultural melting pot, which is India. And this young BJP leader proved that she can actually walk the talk with a fine balancing act that showcases her multitasking abilities. And Her Excellency Honorable Ms. Smriti Irani is currently the Union Minister who's holding the textiles portfolio with additional charge as Minister of Women and Child Development. And a steady rise in her political career, a commendable feat in any country, is a massive achievement in the biggest democracy of the world, India. And today we're very honored here at AIBD to welcome Your Excellency, Honorable Smriti Irani. It's all yours now. Madam, welcome to the program.
Thank you, Excellencies, ladies and gentlemen. For me, it is a delightful opportunity to share what India aspires for its women and young girls. I address you in a month where the entire nation has congregated, irrespective of the challenges that the pandemic brings to us, with regards to nutrition for women and children. As we speak in this National Nutrition Mission, which is the flagship program of the Honorable Prime Minister, we celebrate our potential to nutritionally, administratively, and financially support better health prospects for women and our children. I'm delighted to share with this august audience that under the Prime Minister's leadership, this first ever convergent efforts between 15 ministries of Government of India and all state governments across the nation as of last year saw a participation of over 30 million activities that were undertaken by not only the government, but the people of our country. And while we speak of nutrition, I must highlight to the august audience that in the pandemic, we in the Government of India have ensured that there is doorstep delivery of supplementary nutrition to women who are pregnant and lactating and children between the ages of 6 months to 6 years. We have, in the past 3 months, delivered at the doorstep of 80 million such beneficiaries. Additionally, I would like to flag that the Honorable Prime Minister ensured that to fight the challenge of COVID-19, our families are well fed and protected with regards to their daily needs. In India, under the aegis of the Honorable Prime Minister, we have ensured that 800 million citizens received free ration and food supplies up to the month of November. This being said, when we speak about women's road to freedom economically, we in the Government of India, under the Prime Minister's leadership, have dedicated ourselves to help support the aspiration of young girls from the birth itself. The Prime Minister propounded and engaged with state governments to ensure a program called Beti Bachao, Beti Padhao was dedicated to the country, which is particularly fighting the challenge of help increasing the sex ratio at birth. The audience will be delighted to know that in the past 5 years, ever since this endeavor was undertaken, in terms of sex ratio at birth, India has progressed by 13 points. However, we wanted to encourage more and more families and parents to financially start supporting the dream of our young girls. And that is why the Honorable Prime Minister initiated a program called Sukhanya Samriddhi Yojana, wherein families are encouraged to deposit money in banks in the name of the young girl child. And such accounts will have the benefit not only of taxation, but also have benefits with regards to higher interest rates. The audience will be delighted to know that today, as we speak, over 15 million such bank accounts are specifically dedicated to the girl child in our country. Recognizing that the girl who goes to school needs adequate sanitary protection, the Prime Minister directed all government agencies, including state governments, to come forth to ensure that toilets are built for our girl child in school. And today, not only in school, but also in communities and at the workplace, India can proudly profess that in the limited period of 5 years, we have built for the first time access to such sanitation projects and toilets for over 110 million individuals and families. This being said, the government has also ensured that the national education policy, which was revisited after 3 decades, finds a special mention for the Gender Inclusion Fund. This will enable our state governments to ensure that our girls transition from school education onwards to institutions of higher learning. But once the girl enters such institutions, can her dreams be economically empowered by financial support from the government? For the first time in the history of our country, our Prime Minister, through our banking system, reached out to our citizens to say, let every citizen have a bank account, even if they belong to economically challenged backgrounds. And in the past 6 years, under the Pradhan Mantri Jan Dhan Yojana, we have for the first time opened bank accounts for 440 million citizens in our country, of which 220 million are only women. How does that help support women's endeavors, especially in COVID times? Well, in the past 3 months, after opening up of bank accounts for those women who belong to economically challenged backgrounds, the Prime Minister has ensured that the Indian Treasury directly transfers money to these bank accounts of 220 million Indian women. Over the past 3 months, 30,000 crore Indian rupees has been directly transferred to the bank accounts of women so that they can fight financial constraints that are being brought upon their families because of the pandemic. Additionally, women in our kitchens were always challenged by non-access to clean energy, clean fuel. We began under the leadership of the Prime Minister a historic project called Ujjwala Yojana, wherein citizens were implored to support access to clean energy to women from poor families. The audience will be delighted to know that in just 5 years, 80 million women were brought under the umbrella of this project. And in the pandemic, they receive clean and free energy under the aegis of the Ujjwala Yojana right at their doorstep. One of the prerequisites to financially empowering women is to empower her health and medical needs. Under the leadership of the Prime Minister, for the first time in the history of our country, we have seen Ayushman Bharat, the first ever engagement by Government of India to ensure that over 100 million of our citizens and families receive a yearly insurance credit cover of 5 lakh rupees per year, which gives them facilities with over 30,000 hospitals across the country for over 1,300 medical conditions. And just so that we can reflect on how it has helped poor women, till September of last year, over 500,000 women got themselves screened for breast cancer and cervical cancer free of charge because of the support they received from Ayushman Bharat. I must, however, admit that on the road to empowerment, the pandemic did throw up a lot of challenges. But when we celebrate COVID warriors in our country, our doctors, our nurses, our health workers, women have been at the forefront. Over 2 to 3 million women in the form of ASHA workers, primary health workers, and Anganwadi workers have helped governments at the center and the state do house-to-house testing, thereby trying to contribute towards curbing the menace of the pandemic. And the government of India has provided for each such health worker an insurance medical cover of over 50 lakh of rupees so that their family's rights as theirs is protected in these challenging times. The government, to ensure that the working space for women and children, and especially young girls, is protected, has for the first time under Nirbhaya Fund ensured that 1,023 fast-track courts, which completely dedicate themselves to providing judicial remedy to women, especially in cases with regards to harassment or violence against women, these courts are being established. Additionally, we, for the first time in our country, now have in every district of our country a functioning one-stop crisis center. Along with it, the government of India has sanctioned for every district an anti-trafficking unit, and for every police station a specific desk to help women and children in need. In the pandemic, recognizing that women and children who are vulnerable are in need of protection, we have serviced through 30 helplines the needs of women who want to be protected. And in the past 4 months, over 90,000 women across the country, between the center and state in a cooperative mode, have been supported. When we talk about economic empowerment, apart from opening bank accounts, providing for healthcare needs, and providing adequate support for the academic aspirations of our women, I must also here highlight that the government for the first time has a dedicated ministry for skill development. And under the aegis of skill development ministry, in the past 4 years, 3 million women have been skilled so that their economic prospects can be enhanced. There are many who let go of their academic pursuits for they wanted to generate employment opportunities for themselves, and over 400,000 such women have been certified and their prior learning experiences have been recognized. I can only say this, that women will lead from the frontiers is an adage not reduced to just pages of administrative history. For the first time in the history of our country, we have women who have received permanent commissions to serve in all 10 branches of the Indian Army. Additionally, 33% of posts have been reserved for women in paramilitary forces, and Mudra Yojana, which is one of the government's largest credit programs, has seen 70% of beneficiaries which are totally dedicated to women employment generation, or for that matter, which are totally supporting women entrepreneurs. I can only say this to the August House, that we have in our 70 years of independence seen administration after administration dedicating itself to empowering women. The Prime Minister says that now is the time for the nation to benefit from the leadership and contribution of women. And we have now made sure that women-led development becomes the mantra for the Indian government. Given that today, while I address you, shortly after this address, I will be joining a group of ministers which will present to the Indian Parliament the first ever stringent law which will help protect women and children from trafficking. I think we are on our way to ensure that women lead societally, politically, economically, all of us to a better tomorrow.
Thank you, Your Excellency, Honorable Smriti Zubin Irani, for that wonderful insight into women empowerment right there in India. And I can safely say that women can actually create a lot of change. And even as you're talking, I do know that you're working on a very strict anti-trafficking law. So we wish you every success in this. And it's wonderful to note that with the Modi administration, women are in the forefront and being able to bring so much of change to a huge nation such as India. And we also wish you a safe journey, because India is also going through a huge struggle at this point in time with COVID. So we wish you all the best, and thank you, Honorable Smriti Irani. We move on to our next speaker. She is a lady who is in the forefront of COVID management. We're talking about Her Excellency Sara Duterte, Mayor of Davao City, Philippines. And she was the Deputy Governor of Central Bank as well. And she made history when she switched her roles with her father, Rodrigo Duterte, from 2010 to 2013. And Ms. Duterte was also one of the 9 elected governors of the Philippine Red Cross in 2014. Ladies and gentlemen, please join me in welcoming Ms. Sara Duterte to share her thoughts on women in the forefront of COVID management. Sara, it's all yours now. Thank you.
Satanan. Good day to everyone. My warmest greetings to the distinguished women leaders who will share their knowledge, expertise, and experiences about the coronavirus disease pandemic that continues to burden and challenge the world today. On behalf of the people of the city of Davao, I express my gratitude to the organizers of this forum for the opportunity of being able to share our own story. There is probably nothing unique in our approach to curb or limit the spread of the virus as compared to the ones being implemented by other cities around the world. However, I would like to bring to your attention the fact that the success of the city is underlined by the collaborations and partnerships and the cooperation established between the Davao City local government, the private sector, even foreign countries, and the people of Davao themselves. The fight against the spread of the virus in Davao City would have been a no-win battle if not for the strong ties that we at the local government were able to secure before and during the pandemic. At the onset, I was aware that the crisis demands an effective and efficient response from people with expertise, experience, and knowledge of deadly diseases. I immediately reached out to the Davao City-based epidemiologists and infectious disease specialists, both from the government and private health institutions. Since day one, in our fight against COVID-19, they worked with us and guided the local government in setting policies and protocols designed to slow down and hopefully stop the spread of the infection. While there are still questions about the role of wearing face masks in reducing the transmission of the coronavirus, Davao City already imposed its mandatory use whenever people are in public places. The doctors also designed reusable, washable face masks that have been distributed to those who could not afford commercially sold face masks. I have personally campaigned and encouraged the use of face masks, largely intended to protect the people against the spread of infection. Never was I seen out in public without a mask on, simply because I believe that the best way to influence others, especially those who look up to you, is by showing example. The other component of our active campaign is for people to stay home except for essential movements, to strictly observe 2-meter distance from each other, and the frequent washing of hands with soap and water or the use of alcohol-based hand rub. The wearing of face masks, staying home, social distancing, and frequent hand washing are the 4 minimum health practices we relentlessly ask from the public to follow. Our guidelines are based on the recommendations of our health consultants. The guidelines include limiting mass gatherings of people, such as special events, because the spread of the virus can happen in areas with a large volume of people. The warning was clear. You will likely get infected if you go to places where people gather or meet. We have also implemented community lockdowns where people are prevented to move in and out of their communities if there is an alarming number of the coronavirus cases. We know this affects people's jobs and livelihood, but this is also coupled with immediate food assistance and other social interventions to affected residents. I was aware that there were resistance of these policies and protocols, but there was no way that we should back down. We must enforce, and we did. I also saw the importance of rewarding communities for registering the lowest number of cases. And these communities were the upland areas or hard-to-reach areas inhabited by our local tribes of indigenous peoples. Not only the IPs, I also involved the LGBTQI in our food distribution activities. It was a responsibility that highlighted how the members of the sector could organize themselves and work to ease the condition of a sector affected by the crisis. We were also able to get our farmers to partner with us in addressing pressing needs and at the same time providing them economic empowerment. As a way to engage the public and open the line of communication with them, I launched a daily program aired over the Davao City Disaster Radio, a radio station owned by the city government. Every day, on air, I used the platform to explain the decisions, measures, and policies that we were implementing. I also consciously asked them to understand, encourage them to cooperate, and enjoined them to support the steps undertaken by the government as they were crafted to protect lives. I recall one day, I was on air for 8 hours to answer queries and provide explanations and answers to questions about community lockdowns, transportation, jobs, food, medicine, and hospitalization. For 8 long hours, I listened to some angry calls and complaints and expressions of hostility to the health protocols we have laid down. It was exhausting, but it was heartwarming at the same time, knowing that the people of Davao and the local government were engaged in a dialogue that underlined a common goal: the protection of the people against the deadly virus. Despite some expressions of doubts and questions over some of our policies, the dialogue on the radio became the people's platform to air their commitment to support the government. At one point, I was comforted by the fact that the people were behind their leaders, supporting us in our efforts